Namaste. I am Dr. Professor G.G.Gangadharan, practicing at Badraapa Layout near Hebbal in Bangalore. For last 40 years, I am in the clinical practice of Ayurveda. Shashtika Pinda Sweda, or Navarakizhi as it is known in other parts of the country, is a strengthening treatment. It is a kind of pain alleviating treatment. It is a kind of vata alleviating treatment. It's a kind of kapha-increasing treatment. Navarakizhi is a wonderful treatment to strengthen your muscles, nervous system and circulation. And Navarakizhi is a procedure. It is based on a kind of rice which grows and matures in 60 days time and which is rich with starch, and it is very sweet in taste and it is heavy to digest. So Navarakizhi is a preparatory treatment as far as Panchakarma is concerned, but is an independent treatment as far as Kerala Panchakarma is concerned. Navarakizhi is normally never done as a first level of treatment because Navarakizhi is actuating. It has to be worked in the body if completely ama is removed. So normally we do 7 days of pirichil or kind of Tailadhara on the body from 45 minutes, 50 minutes, 55 minutes, 60 minutes, 55 minutes, 50 minutes, 40, like 7 days we increase and decrease oil application in the body, specific kind of oil. Then we give one Virechana, then we start Navarakizhi as a second level of treatment. So normally a 14 or 15 days treatment, the last 7 days are devoted for Navarakizhi or Shashtika Pinda Sweda. Why Shashtika Pinda Sweda is important is in a lean body where body is emaciated or body is having less kapha and high vata and pitta in between, that condition where this Navarakizhi is used. Only caution one we have to make that Navarakizhi should not be used when ama is present in the body. It can be very contraindicative and it can cause many things, especially skin diseases and kind of indigestion and other kind of chronic disorders. So normally we do Shashtika Pinda Sweda after a course of Tailadhara and Virechana, then we start the Navarakizhi. Navarakizhi is done mainly to improve the muscle tone, increase of circulation and also improve the nerve conductivity. And we do also in pediatric cases where people have got mamsa shosham, there is emaciation of muscles due to various disease conditions, people with spastic body, spastic children, and people with pakshaghata or one-sided hemiplegia, or people with the kambhavadam kind of Parkinson diseases. And specific type of things are used in some skin conditions where we add some specific things to Navarakizhi treatment. Navarakizhi is a general term. We can change the ingredients of Navarakizhi, keeping the rice, that is Navara rice, Shashtikam as the main thing, but we can add ashwagandha, we can add bala root powder, and it is always processed in good cow's milk. It's like of a rice bolus covered in a very good cotton cloth, made into a pottery, and it is applied all over the body. Normally, Navarakizhi is done by 5 people. One person, 4 limbs, 2 upper limb and 2 lower limbs. So 4 persons we are doing, because when we do Navarakizhi, the whole body should be equally tended so that temperature difference should not be there from one part of the body to other part of the body, and circulation also should be enhanced. This is not done on people who are very weak and people with less cardiac effusion. Then we should cardiac issues. Then it can be very carefully this has to be used in that condition. This is normally and mainly and majorly used in pakshaghadam or hemiplegia. It's a wonderful treatment because it can directly nourishes the muscle tissues externally without giving internal medicine. That is the importance of Navarakizhi. And Navarakizhi is to be done either 7 days or 9 days continuously. In certain cases, even 14 days Navarakizhi has been done. People tolerate that kind of thing. But it is a sure thing to improve your internal metabolism. Your Agni also get rejuvenated by external Navarakizhi. And all the conditions of Vata-based diseases, Navarakizhi is one of the ultimate remedy from external application, external point of view. And Navara rice is an indication. It doesn't mean that you should always use Navara if another part of the state when you can get equally unctuous kind of a Navara rice, which is highly kapha-vardhaka, that can be used to replace Navara if you don't get Navara. But the importance of things that should be very kapha dominated, kapha promoting rice and should be cooked in herbs. If you want only vata to vitiated, this bala roots are used in the milk. If you want to more strength and virility, then you can put ashwagandha to that combinations. If there is a skin problem involved, then we add manjishta or aragata decoction to the preparation of Navarakizhi. This kind of variations are done by veterans who know the specific conditions of the person in question. And Navarakizhi is normally never done as a first line of treatment because of the reason I told you earlier. There should not be no residue of ama in the body, then it can bring in inflammation. After the treatment, people may not be able to move the joints. Joints become very stiff and inflammatory after that time. So Navarakizhi or Shashtika Pinda Sweda is a wonderful treatment and which is a unique feature of Ayurveda, which is used for the wellness treatment area as one of the very popular treatment after the famous Shirodhara which people seek for. So this Navarakizhi can be done, especially people above 45. When the regeneration is less than the degeneration, Navarakizhi is the answer. Aging people, Navarakizhi is being done. Pediatric condition, muscle emaciation, it is done. In conditions of skin diseases, with the specific Navarakizhi is done. And all these conditions, either it is as a continuous way of doing it or equal gap you can give and do it. We do Navarakizhi in certain conditions once in a week time also, depending upon the situation of the patient.